I had a heart transplant on April 3rd, 1995, when I was 5.5 weeks old. I'm from St. Charles, Missouri, and I attend St. Charles High School as a senior. I am currently 17 years old.
I know Jake. I was a new nurse at Children's Hospital, and I had just gotten through all of my training, and he was my very first patient that had had a heart transplant.
I was about 9, and a lot of the patients, a lot of the kids were invited to come to this amazing 5-day, 4-night camping experience.
We had a child that was seen here at the hospital who packed up his overnight bag and his bag with his 32 daily medications and went to a church camp. He was told when he arrived at the camp that he couldn't stay because he was too sick for their camp. And I said, well, we should just start our own camp. And we did. It's just a collaborative bunch of kids who have lots of different problems that they bring. And with that, they bring a lot of pills, a lot of treatments. We're able to deal with that, but on the other side of that, we're able to give them everything that a child who has no problems experiences when they go to camp. We have 10 nurses a day to give medicine. So because everyone gets morning medicine, everyone gets evening medicine, you don't have that in a normal camp. And if you had to put a dollar amount on, what that would cost the parents to be able to send these kids, to have someone, to have a physician and a nurse on duty with their child for the entire week, people just wouldn't be able to do it. It would be cost prohibitive.
People who give to Camp Rhythm are helping these kids experience something that should be such a fundamental experience. But it can't be, because kids with heart transplants and kids with heart defects in general, they can't go to other overnight camps because other camps won't take the responsibility. They don't want to be liable for it. But the people who work there are nurses and doctors who've been through all this, who know these kids, and they're in no safer hands.
I'm Christy Merrill. I am the music therapist here at St. Louis Children's Hospital. Music therapy is using music for non-musical goals. So I work with patients who have had traumatic brain injury or some neurological devastation and use music to help them relearn walking patterns, relearn memory, speech. There's not a particular place in the brain that has music. It's global. So music is a really nice way of helping the brain connect new ways of learning through or around the damaged areas. Music gives a voice to those kids and gives them an outlet, a creative outlet that other conventional therapies don't have the ability to. It's just a combination of really kind of knowing, building that rapport with that patient and knowing what it is that you can help make them successful and accomplish a goal. I just love being able to watch these kids be kids, and they're not, oh, it's the kid with cancer, it's just the kid that, that doesn't define who they are. I'm grateful for all of the donations and the time and even wanting to help out music therapy or expressive therapy programs, because the living example, I can see the difference it makes in these kids.
Brendan was born in July of 2005, a healthy term little guy. And 11 weeks later, I had found a bump on his head. And that was kind of the beginning of our journey. That's when we found out that he had AML leukemia. And I'll never forget when we were up on the 12th floor, seeing Todd and another oncologist come around the corner to tell us the horrific news.
I met Brendan when he was 2 months old. Blood tests at the time showed that he had a type of infant leukemia called AML, acute myelogenous leukemia. And he underwent several months of intensive chemotherapy. He spent most of his first year of life in Children's Hospital.
One of the major hoops was getting through the PICU ordeal because we truly didn't think he was going to leave the unit at that point. And then when you get through the end of treatment, it just takes time. We know that without research, without money put into research, he wouldn't be here, he wouldn't have had a chance.
My lab is in the Center for Genome Sciences and Systems Biology, which is a multidisciplinary center of about 12 faculty members who all use genomic technologies for their particular research interests. My interests are to use the genomic capabilities here at Washington University in this center to look for individual profiles of genetic changes that may predispose these children to cancers at such young ages. We have tremendous capabilities, but the resources to execute the vision is unfortunately lacking, particularly for children's illnesses across the board. I'm very happy to say that Brendan made a tremendous recovery. He's now finishing kindergarten. He's a healthy, happy, active, completely normal little boy, and he's one of our real success stories, and we're very proud of him.
He's doing awesome. He is almost 7 years old, and he's our miracle. He's our blessing for sure.
St. Louis Children's Hospital Foundation provides funding for many important hospital programs that benefit children and their families. Thanks to your support of programs like Camp Rhythm, music therapy, and research in the Children's Discovery Institute, we are able to do what's right for kids.